Welcome, dear friends, on MuniMeterHealth, your source of learning cardiology and human heart awareness. I'm Dr. Jaitly, your cardiologist on MuniMeterHealth. Welcome again. Just like in short segments, we discuss, small little subjects. Here we're going to be talking about today, chiefly, what is aortic valve area. Now, before we discuss aortic valve area, let's understand why is it important to know about it and how it is measured. Well, it's important to know that aortic valve area is the cross-sectional area, I'm drawing it schematically, through the aorta, through which the aortic valve, which is situated at the root of the aorta right here, the blood is flowing through. Now, aortic valve leaflets, as you know, they open up fully so that the flow is unhampered. Now, in the setting of aortic stenosis, the aortic valve cross-sectional area, actually the functional area, may be narrowed. So the valves do not open fully, and as a result, you have the flow going only through this orifice. So the effective orifice in the aortic stenosis is narrower, and the aortic valve, which is normal, it has the fullest the valve leaflets almost come close or juxtaposition to the inner lining of the aortic root, if you will, and as a result you have an unhampered flow. So having said that, we understand why aortic stenosis is important. So aortic stenosis is, again, it could be of a mild variety, it could be a moderate variety, or it could be a severe. A mild normally is considered as more than 1.5 square centimeters. Moderate is anywhere between 1.5 to 1 square centimeter. And the severer the stenosis is, the lesser will be the area, obviously. So it'll be less than 1 centimeter square. We can write a centimeter square, square centimeter. Now, it's very important to know how aortic valve area non-invasively can be calculated. Through an echo, for instance, if you were to look at an echo, this is how the heart will look like in a setting where you have an apical view, where the heart is actually represented invertedly. So you have your mitral valve here, for instance, and the aortic root coming out here in this fashion. So as a result, the blood is going in this direction and coming out through the left ventricular outflow tract, and it'll be out like this. So this being the right ventricle, this being the right atrium, this being obviously the booster chamber, the left ventricle and left atrium, just to orient my students, residents and fellows. So when we look at the aortic root, we need to know the cross-sectional area of the aortic root. We need to know certain other parameters. And all of this is incorporated in an equation called continuity equation. A continuity equation has a principle, and the principle is the following, that it's based on the principle that the flow proximal to the stenosis, proximal to the aortic valve, which is just here in the left ventricular outflow tract, is equal to the flow at the stenosis. That means at the valve. Okay, so flow proximal to the stenosis. In other words, whatever is going in to the left ventricular outflow tract is also coming out through the aortic stenosed valve, one way or the other. So going in and going out is equal. Okay, now the parameters may change because the pressure and the velocities may be different, but the flow, which is the volume, that stays the same regardless of the stenotic area. So let's calculate how do we calculate the flow at the proximal level first? So let's understand that. So we know by good old geometry, the cross-sectional area of the LVOT, which is the left ventricular outflow tract, times the velocity time integral, which is calculated based on a continuous wave that is placed at the left ventricular outflow tract right below the aortic valve leaflets insertion. That is your VTI of the LVOT. will be equal to the flow at stenosis, and that's calculated as cross-sectional area of the aortic valve, which we'll call it as AVA, aortic valve area, times the VTI at the aortic valve. So this equation is very, very important. Now we know we can calculate the VTI of the LVOT, we can calculate the VTI of the aortic valve, and we can measure the cross-sectional area of the LVOT. All we need to do is measure AVA. How do we measure AVA? We measure AVA by the following transposition of the equation, and that is, if you substitute the CSA LVOT, for instance, the cross-sectional area of the LVOT. Now take example here, for instance. This is your aorta, and this is your aortic valve insertion, and right below is your LVOT. So LVOT is here. So you want to measure this diameter from the inner edge to the inner edge in the mid-systolic position, and that could be measured just by calipers on your 2D on your regular 2D picture of your echo Doppler. Now, just to reaffirm and make it more simple for some students and residents and fellows here, if this is your aortic root, this is your mitral valve, and this becomes your left atrium, here's your left ventricle, and this is your septum here, and of course the RV is sitting out there. So your aortic valve leaflets are right here, and this becomes your this is your CSA of the LVOT, remember. So you measure this, and this is the diameter. You can measure this diameter, and therefore you can measure the cross-sectional area. So the diameter, for instance, is about, it's 2 centimeters, okay? So say if it's 2 centimeters, then the radius would be half of the diameter, that is 1. So what is the cross-sectional area of the LVOT? It'll be 3.14, and what is that? That is the pi. Remember the good old equation, pi r square? So same way you'll calculate the CSA here. 3.14 times, the radius was 1 times 1. And that multiplied by VTI LVOT. The VTI LVOT that you'll measure here with the continuous wave Doppler in an apical view, will be measured in this fashion. It'll look like this. And that, say, is 20 centimeters. So multiply that by 20 centimeters, okay? And then that is equal to the aortic valve area, which we don't know, but we do know which we will calculate, but the fact is that we do know the VTI at the aortic valve. Now calculate the VTI at the aortic valves, and again in the apical view you'll measure and put the Doppler right at this level, and you will be able to get the VTI in the aortic valve, at the aortic valve, and say that is 120 centimeters. So we calculate that as 120 centimeters. Okay. So in a nutshell, what is the aortic valve area? The aortic valve area will be 3.14, which is times 1 by 1 is 1, still 3.14 times 20. That's your VTI LVOT divided by this 120 will become the denominator, and therefore the AVI is roughly approximately 0.5 centimeters square, right? So if you calculate this, it comes out to 0.5. So that means it's a severe stenosis depending upon the VTI that you calculated at the aortic valve level and the VTI that you calculated at the LVOT level. Here we computed 20 centimeters, here we computed 120 centimeters, and the aortic valve area was calculated based on the CSA, which was already calculated as the diameter times half, which is roughly 1 centimeter, because the diameter was 2 centimeters at the LVOT level. Okay, so aortic valve area is actually calculated by the continuity equation, which is based on a principle that the flow proximal to the stenosis is equal to the flow at the stenosis. Okay, so aortic valve area can be very easily calculated by the continuity equation using the echo Doppler technique. A few caveats. Just remember that when you're using the continuous wave Doppler, be sure that you're using it in the apical view and record the highest and the most continuous jet, if you will, and the highest velocity, so that this way you don't underestimate the aortic valve area. Very important, because you may get another area which could be like this, another velocity could be like this, but you're getting the highest velocity. So record the highest velocity, not this velocity, number one. Number two, when you're measuring the cross-sectional area at the LVOT, always measure that in the long axis view, just like I've shown it here in the long axis view, and there you're measuring it in the mid-systolic segment, mid-systolic frame, if you will, and the inner edge to inner edge is calculated right beneath the aortic valve leaflet excursion. Don't measure it here, that will be incorrect. Measure it right here beneath the aortic valve leaflets, that's allowable. Okay, and then of course the half the diameter would be a radius, and then compute that into the pi r square, which is your cross-sectional, which will give you the cross-sectional area. Okay, so as simple as that. And remember, this also becomes your stroke volume, more or less. So this is your stroke volume. What is because it's a flow, so this is also your stroke volume. And remember, cardiac output is equal to stroke volume times heart rate, and of course we'll discuss that at a later time, but just so that you know, your stroke volume is already calculated here as soon as you calculate CSA times VTI. Okay, so I hope this segment was very helpful to all our students, residents, and fellows, and of course colleagues like me who've been in practice for a long time, but we tend to forget, or sometimes just don't recall what the continuity equations are and what have you. Of course, now there are technologies which will actually measure the aortic valve area right thereof as soon as you compute all your parameters in, so you don't even have to bother with the calculation. But this is how it's done, and it's good for the exams. And again, I always recommend that please use MuniMeterHealth segments here that I teach, the video segments, primarily as a supplement, not as a substitute to your syllabus, just so that you know. And again, it's only an educational channel, it's not a teaching channel, it's not a medical advice channel, just so that you know. And if somebody's having an emergency, you should go and see a doctor or get to the nearest hospital rather quick. Okay, thanks again, and please continue to subscribe, like if you like our video segments, and of course share with your friends, colleagues, and your other students and doctors, please. And stay on MuniMeterHealth, your source of learning cardiology.